afternoon, everyone. My name is Brian Behringer, and I am a sales engineer at Call Trichometrics by day, but today I am serving as a moderator here at Demo Day. It's my pleasure to introduce Shelby, a seasoned professional with numerous years of experience in behavioral health. Today, Shelby will be sharing valuable insights on Alleva, so let's get some clap emojis in the chat for Shelby.
Awesome. Thank you so much, Brian. Appreciate it. Happy to be.
Before we begin, I wanted to go ahead and open some time. So, in your experience, what are some of the most effective strategies tech-wise for improving client outcomes? And if you have a customer success story to share, we'd love to hear it.
Yeah, I think, and I'll definitely dive into this in my presentation a little bit, but definitely one of the things we really preach here at Alleva, I would say, is the importance of data. And I know, for those of you guys who attended Sam's session right before mine, one of the things I heard him say was like how really like almost neglected overall healthcare was in tech for so long and even until like pretty recently. And then even more so, I think to like dive a little deeper into that thought is, there's the tech and then there's the data behind it. So when we're talking outcomes measurements, like where my mind goes is the true data captured and the tech that allows you to capture that data. And so again, on my presentation, I'll dive into what we call Alleva Insights. It's our data reporting business intelligence tool. And I think what is really cool about it is it allows these programs to have real-time data as well as like the power of automation in their data too. And so as far as like examples go, I mean, I think one that like really hit home to me when I very first came on with Alleva and was learning our platform, we do have a client mobile app that does allow for client questionnaires, assessments to be filled out and things like that. And I think what's really great is the data from that can be collected. And so one of our customer success stories that we share that really was like eye-opening to me was actually like, I believe it was a IOP level facility, but someone had documented that they were, feeling very depressed. They filled out an assessment that was like the outcomes measurements were very below normal thresholds and things like that. And that they were having like suicidal ideations. And to a normal program, that may have like a mobile app, but doesn't have that data captured on that, like they would have to manually go in and see that, or, a clinical director or clinician is actually going in maybe the next day, or, they have a full caseload. So it might be a couple days past before that actually gets noticed. And with the power of like automation and one of the cool features in our insights tool is it actually allows like alerts. So if like certain things are either below a certain threshold when it comes to like outcomes, or maybe like with discharges, for example, like above a certain threshold, then like the proper people can get notified. And with this one specifically, a clinical director was able to get notified and kind of step in and take those proper protocols and get them in and potentially save a life, since they were having suicidal ideations. So I always think that's a really cool story to share. And again, I'll kind of dive into the data aspect of it later, but I definitely think that that's huge in the industry and a part of the industry that's growing and being heavily educated on, which I love.
I couldn't agree more.
Yeah. Well, I can jump in and share my screen real fast. Awesome. So in the beginning here, I'm just going to kind of give an overview of the background of Alleva. So we like to say that we are one of the advanced data-driven solutions within the behavioral health industry. So kind of to echo my previous story is, I think one of the biggest differentiators and our standouts or key features is our data reporting. And really that was the forefront of like the creation of Alleva. And I promise I won't read this word for word, but just wanted to give again a background of Alleva, but also our CEO, Steve, give him a shout out and like our founding story. So we started in 2016. Steve has a product background, and so he was working in healthcare outside of the behavioral healthcare space, but was able to kind of utilize his product and technology background and actually had an event occur in his life where a close friend was affected by drug addiction and suffered an overdose. So it was at that time that he really understood that, and kind of going through the motions of, being there for emotional support, but throughout the journey of his close friends like treatment was where he really learned how like lacking the tech space was in not only healthcare but the behavioral health space. So with his background of that, he really took this and ran with it. And what I do think is really cool too, and the bottom paragraph kind of explains this, is obviously because Steve has that tech background, like that's a forefront of why Alleva, I feel like, has like a data-driven and user-friendly platform. But what he also did is understand that, just because he has a tech background and sees this need in the industry, that he's not going to understand workflows and like a clinician's mindset all himself. And so from the fruition of Alleva, like he really brought in industry experts, and even now on today's team too, because obviously, we've grown and stuff and built our team since 2016. So some of the people on our team are licensed clinicians. On our support team, we have licensed clinicians, nurses. We've had executive directors that have worked directly in the space. And so again, from the beginning of Alleva and even today, as we continue growing, like we're really hearing the background of those industry experts and kind of continuously building, and even like the platform that we were originally built on was very much so vocalized from those working within the industry and hearing like the needs of what would help and make it a better platform for them to use. So this is really, again, like kind of what we were built on is our slogan is we're here to help the helpers. So with that in mind, like a big part of what we do here is we want to allow those within the programs, clinical directors, clinicians, kind of almost specifically, to get in and out of our platform as quickly as possible. We understand that treatment doesn't occur within the EMR, but it's such a needed thing. I mean, most states are actually requiring them now. So it's essential to the livelihood of their program. And so having a user-friendly experience and a platform that is easily learned, easy to navigate, and then also like useful, again, going back to the data, something that you guys can get out of it as programs, I think is, again, kind of just the forefront of what we want to do. So going through this today, what I'm going to talk about is some of our key features in here. I have some screenshots of our user interface. I'll dive into our task space and then compliance driver. I think those kind of go one and the same. And then I'll talk a little bit about our admissions. We do have both a client portal as well as mobile app. And then some of the other things too, I'll get into the weeds a little bit on some of my slides, but yeah. And so the background here, I know I graded out a little bit, but I wanted to emphasize our task-based approach, but this is going to be the overall dashboard of Alleva. So when logging into our platform, what anyone logging in is going to be met with is their task list. And what we really wanted to get away from was a chart-by-chart approach in the system. So it's going to be kind of a common theme, and sorry if I repeat myself a little bit, but there was two things that we were really built on. And again, it's that kind of diving away from that chart by chart approach, but also the few amount of click paths. So during the creation of Alleva, we noticed that a lot of other systems that were, being used back then, the click paths or how to start charting or things like that, it was definitely hard to navigate, especially for clinical staff members and things like that. So our whole goal was anywhere in the system that you should be able to get to in 3 clicks or less. And so with that being said, the forefront of an electronic medical record is the charting. So individual sessions, group sessions, like BPSs, things like that. So our task list is going to be derived from what's scheduled out in our calendar, but it will pull chronologically. So another big thing is compliance within the programs. So it will populate chronologically from oldest to newest. So if clinical staff members are working their task list from top to bottom and clearing it out on a daily or weekly basis, really they should be staying in compliance for their documentation and their charting. Some other aspects on here too, I know I covered this a tiny bit, but just to touch on it while I'm on this screen is we do have a communication log as well. So even it works for all levels of care, but I like to highlight it more for the inpatient detox residential treatment centers that um, if they're needing to communicate with one another, I know that we all use email, text messages, whatever it may be. But it is a way where you can actually set alerts and notify either all staff. It kind of works as like a Twitter or an Instagram. So you can like @tag someone. You can make it urgent, warning, or informational. So different kinds of alerts come with different features on them. An urgent alert will actually allow staff members to sign and acknowledge that they've seen that alert. So something like a suicidal ideation or things like that, where it needs to be documented. And the importance of that is so everything within that organization can really live in the EMR and be tied to a client chart, and also remain HIPAA compliant too. I'm talking about HIPAA compliant, and also just overall compliance. So we have built in, we like to call it a compliance driver. These are a couple of like our warning flags that will appear. So where these appear are a few different areas. So the first one over here on the left, hopefully you can see my cursor, I'm kind of hovering over it, but what that will live in is like a session note. So if a clinician is doing their documentation and they are saying, he was sad and signing and saving that. I think everyone on this call or within the industry will know that that's not going to get you guys paid from an insurance company. It's not up to par with any sort of documentation that should be being done. And so we wanted to make sure that like parameters were able to be built into the system by each individual program so that either a clinical director or some overarching management is able to say, and that's kind of what's down on the bottom middle, is certain assessments need to be required. Is there a 25-word minimum that's a requirement for this certain session note? And what the system will actually do is if the clinician goes to save and sign that note and the parameters aren't met, then it will flag and tell you exactly what's missing. So again, that warning that says Beck's depression inventory, that's because that specific assessment was required within that note and it was trying to be signed and saved. The system itself is auto-saving every 10 seconds. So the work that you've done thus far, even if you've gotten called away from your computer, will always save on an ongoing basis. However, what it won't do is allow you to sign that note and pull it off of your task list, but then it will flag you. You'll complete that certain assessment or whatever the remainder of the documentation will be. And then the system will then allow you to save and sign, move it off of your task list. And then the task list that I was just showing on the last slide will also house pending reviews for someone in like a QA type position or a clinical director that's reviewing documentation. The other one on there is more on the medication side of things, which I definitely wanted to highlight and talk about because really the programs that are doing medication administration and or observation, like that is one of the highest liabilities that programs can take on. And we wanted to recognize that as an organization. So we do have an e-prescribing feature in there. So I'll kind of touch on that here in a minute. But what it will do is allow the system, like if you're documenting that you're trying to administer maybe a tablet of whatever medication with a quantity of 2 and the maximum entered in that prescription is only 1, then it won't allow them to save and sign that within the system. And then hopefully for the support staff or the nurse or whoever is giving that medication or observing it will then have that kind of knowledge to know like and back up and really review what's going on there and stop any like misdosing of any clients. So this is a screenshot of our prospective client list. So again, I love the Dazos team. I love Sam. I was on his session right before mine. We do have an integration with Dazos, and so I know he mentioned that he integrates with a bunch of EMRs. So one of them is ours. So not to take away from any CRM work or anything like that. The prospective client list is if you are utilizing a CRM, that information that we integrate with, that information will still flow to our prospective client list. And then for those programs that either feel, a CRM's too robust for them or they're not ready to make that step yet, a prospective client list could really act as like a mini CRM, if you will. So it's basically what it is it's going to be an ongoing list of exactly what it's titled, prospective clients that are waiting to admit into that organization. What I like to think of it as is really a bridge that's linking your admissions team and your clinical team. So those are two teams and verticals within any organization that I think work really closely in tandem with one another, but a lot of times they're working out of two separate systems that aren't talking to each other. So our prospective client list was giving us the availability here to allow them to have some visibility into what's going on where. So for this middle section, I tried to highlight it a little bit than the background, but the progress wheel and then the action, or what we call intake bubbles, are going to the bubbles will highlight green once those sections are filled out, and then the progress wheel will always reflect based on those action intake bubbles. So like if one or two are showing, the progress wheel should show like 20% complete of that admission. The action intake bubbles actually are in order from before converting to client. It's admission screening, face-to-face, biopsychosocial, medical intake, and then capturing insurance information. And so if I were to click into each of those buttons, what it will do is we kind of have a standardized approach that's built in with Alleva. The reason I don't necessarily like dive into the weeds on that in these types of calls is because we recognize that every single program is different and they're going to not only be able to require certain workflows that are unique to their program, but also, we work across various states as well that are adhering to different state laws and regulations. So again, we have very like kind of basic built out structures within them, but those can be configured, adding in, program unique workflows, state specific forms that you're needing to add in, things like that. So we definitely build that out during our implementation process, and on an ongoing basis, those can always be leveraged by like our customer success team if changes need to be made, or we do train and have you guys have like the autonomy to kind of go in and play with them if any workflows change at all. We do have a client portal as well, which I think is great. So it does allow for programs to have people either apply to their program or just on an ongoing basis utilize their portal to be reminded of sessions, complete like homework or any ongoing forms, assessments, things like that that they need to sign off on. It does start at the admission process too, if programs want to utilize it. I always recommend that. I think it's great. So upon even application, you can have a packet sent out to a client's portal where then prior to even stepping on your premises, say it's a in-person one versus like more of a telehealth type program, then they can already have all of that documentation completed and into the system. And then they can get going just on day one, and they're not having to sit there and fill out forms. And that's their first introduction of the program. It does also come with a HIPAA compliant inbox too. So I have this labeled client portal. I think that's the most widely used kind of person using the portal, but it is allowed to do like ROIs. So if someone's working with like a social worker, or if it's an adolescent facility and a parent or guardian needs portal access too, then you can grant them the portal access, or the programs can grant them portal access, and then also communicate with that ROI through that inbox. Which I think is great. Sending encrypted messages and emails and things like that sometimes gets a little mundane. And then also kind of hand in hand with that, we do have a client app. So these are some screenshots of what it would look like. It can be, and I forgot to say this for the portal too. Both of these will be branded to that program. So if I go back here, this one, obviously I was on the Alleva demo. So we have this as a background, but it can be fully white labeled. So as a client or even a parent or guardian is logging in, they think that they're logging into X, Y, and Z programs portal. It will just be powered by Alleva. And same with the mobile app. The mobile app, obviously, probably more for outpatient type centers, PHP, IOP, OP. It'll see their schedule on there. And then on the bottom of that schedule on the left-hand side, you can see that little video camera button. So we do integrate with Zoom for telehealth. And so there are quick links on both the portal as well as the mobile app. So if they are utilizing that, then they can just easily pop into their session at any given time. The middle one is showing everything that they have access to. So they do have access to the calendar. If they are doing the assignments, the daily questionnaires, the daily questionnaire, the story I told in the beginning, this is exactly where that came from. So having those questionnaires in there that can be reported on, and you can see on the right, you can configure this. We have this one in our demo listed as mental health, personal health, and then medical health. And those can be separated questions and configurable to meet the program needs. And then there is a quick link to the portal. So there is no messaging system through the app itself, but to keep and remain HIPAA compliant in that aspect, we quick link the portal, which is a web-based program, and then they can go to that HIPAA compliant inbox from there. Won't spend too long on this. As said, we do integrate with Zoom for our telehealth. So through our scheduler, it's just very easy to make it telehealth versus in person. And what happens too when there are Zoom sessions, and you can do these frequencies of alert notifications for in person as well. But for the telehealth, the system will automatically send out the Zoom links to the sessions and then also come with automated reminders too. So there's really no manual work on the back end for these programs needing to do that. And then getting into kind of the bread and butter, I would say, of Alleva, is our Alleva Insights. So again, this is our data reporting business intelligence tool. I took this screenshot. This is kind of a revamped version of it. So if people have seen Alleva, we just kind of rolled out a new UI when it comes to our data reporting that I think is really amazing and kind of cleans it up. So we have these folders that each folder will contain not only dashboards that are full of reports and looks kind of built together, but you can also just have individual reports built in there as well. And what we did is we took the time to kind of section these out, so different verticals, and that's what the folders will contain. And for each program, it will look a little bit different. So if they have certain custom reports or things like that, then there's might be built into different folders, but every single program will kind of have this built out from their customer success team. But yeah, so getting into the reports. So I would say our clinical compliance report is one of the most commonly used reports, and really any report in the system is going to be built from data points that are housed within the EMR. And so we have our kind of standardized reports that every single program that signs up with Alleva is able to use. And then we do tier our reporting system. So if you're more of like enterprise level or are needing like a lot of custom reports and custom data points created, we do have our premier version of it. But this one specifically, what it is it's really tracking that compliance of timeliness to sign documentation. And the reason I think that this is really important is understanding, compliance is such like a major forefront of every program that's in the space. But again, not having the data of understanding like where your program is at, or just using like a gut feeling when it comes to that, or getting dinged on an audit and really having no idea. So this is kind of at your fingertips, and any of these reports that I'm showing little snippets of can be sent to you on an automated basis. So without even like logging into the system, upon like implementation or an ongoing basis, if you wanted any of these reports sent to you like daily, weekly, or monthly, you can automate that and then have it scheduled to you for delivery, and it will just be in your inbox. Um, I think too, I wanted to highlight our outcomes measurements. So on the right-hand side, I think I screenshotted either PHQ-9 or PHQ-9. So what I think is really great about this is, to your question that you posed to me earlier, Brian, of how are outcome or how is tech helping outcomes measurements. So a lot of programs see that on a client by client basis, which obviously is so important, and I think amazing that we're moving more towards this and having it readily available for programs. But what I also think is awesome is you can actually do this within Alleva on a facility level too. So then, you're being able to see individual client's outcome and measuring them on a clinical basis, but how can this data be used from the overall facility? And so, you can do it based on insurance to kind of leverage that for, maybe negotiating higher rates with certain insurance companies. But you can also do it based on like marketing and things like that, and kind of utilizing it and leveraging the system to help other verticals within the program. This is another view of it. I know I touched on this just a second ago, but how almost you can leverage that from, understanding where you're at with those insurances for maybe those in-network contracts that you guys are having. If you're just having those negotiations with like no background or understanding of where you're at, this does help and kind of create a story of, how to leverage this data to really help boost your program, not only on a clinical level, but, on an insurance basis level, marketing, really all verticals within it. And then lastly, I know I'm kind of coming up on time here, but we do have a learning management system. So hopefully, as you saw here, I think on some of the screenshots that I sent of the actual platform itself, it is a very friendly user interface, but we do have our own, we call it Alleva University. So our own, oh my gosh, LMS system, where you're able to go watch very short snippets and learn click paths of the system. They're broken down into different verticals too, so it's easy and you can just utilize the ones that are pertinent to you and your role. And that's it. That's Alleva.
Thank you so much. It's great to see Alleva in action. So for our attendees, if you have any questions, drop them in the Zoom Q&A now, and we will be sending them over to Shelby. And what is the best way to get in touch with you, Shelby, for anybody who has any questions?
Yeah, emailing me is great. Texting or calling me, I can drop that in the chat if that's easiest, or I think I do have that flyer under the resources one too that should have my email and phone number on there as well too.
Perfect. Well, again, thank you so much, Shelby, and everyone. We will see you at the next session. Thank you again.
Thanks.